Yeah, so what we're looking at here, this is just the basic gear that a regimental surgeon is going to have access to, the kind of tools that he's going to work with to either help an injured patient, a sick patient, or to prevent a patient from getting sick or injured. So very mixed bag here, and this is a kind of a never-ending subject. It keeps going, and going and going and going. I can talk about anything you see here, anything you're interested in, so just take your pick.
So how would you help someone who's suffering from illness?
So somebody that was suffering from illness, well, the first thing the surgeon is going to want to focus on, first of all, is prevention. I want to make sure these patients keep from getting sick, at least as best as I can, because we do know sickness was the main cause of death for these soldiers. So if I can keep somebody from getting sick in the first place, it's probably what I'm going to do. Prevention is not always a matter of, giving patients the medicines and the tonics that I have inside the drawer here. It could be something as simple as, well, a new soldier shows up to the camp, and I want to make sure that, first of all, they have their teeth in their head. Because teeth are very conducive to health for multiple reasons. One, if you do have a rotting tooth sitting inside your mouth, and, well, you swallow, that rot and some of the disease maybe inside that tooth is going to travel inside of the body. I want to try and prevent that. So if I see that you do have a rotting tooth somewhere inside of your head, unfortunately for you, that tooth does have to be removed. So hopefully you don't have any teeth in your head that look like this. So because if you do, well, that definitely is a sign of illness, or an early sign of illness. So I want to try and take care of that. And I do have tools I can use to do that. First tool I could use to remove one of those teeth is, Old Faithful. I just use my fingers to go ahead and pluck that out. Or I could go ahead and just use one of the many tools I have on the table here. So these are the two that I would possibly use to remove those teeth. So this first one would be if you have one of your incisors, one of the ones I can see when you smile. If that's rotting, I'm going to go ahead, get a good grip around that tooth. I'm going to tell you to hold still, and I'm pulling it out, just like that. So probably doesn't feel that great. Everything I do here, a lot of it's going to be painful, a lot of it's going to be uncomfortable, unfortunately. But I actually prevented sickness. I got that rot out of your mouth, and I'm going to keep you from getting more rotting teeth in your mouth. And what I'm going to do there is, well, hopefully you will be issued, or you can buy, something like this. You are expected to keep your teeth clean in the 18th century, or relatively clean anyway, of course, because I have toothbrush. I don't have Crest. I don't have Colgate, anything like that. So tooth powders that would possibly be used for these soldiers is some things that we really don't consider to be cleaning products in the modern day. So right away I have this liquid right here. This is a multi-use item here in the camp. So this is actually something that you might have in your kitchen at home. We cook with this now. Many of these soldiers may be cooking with it over there at the kitchen. But this is apple cider vinegar. Very, very good stuff, and, well, the natural acidity that is found inside this vinegar can be used to, well, kill off some very unsavory things inside of the mouth and, well, keep the mouth relatively clean. So you could either use that, just kind of dab it a little bit on a rag, kind of take your finger, rub it around there. Or what you could use is, I mentioned the kitchen earlier. I have plenty of charcoal over there at that kitchen. Charcoal can be used as a cleaning agent to a certain degree. What I could do is crush a little bit of that up inside of mortar and pestle. You could use that to brush your teeth with. Probably doesn't taste that good, but you could definitely go ahead and use that. And also, there was actually documentation to show that tobacco ash, of all things, could be used to brush your teeth as well. So something we're trying to take off of our teeth in the modern day possibly could be used to go ahead and clean those things. But that is just one of many preventatives. Making sure your teeth are relatively clean, making sure the ones you do have left are still, remain intact in the head. Something else I'm trying to make sure you do is, well, bathe. That's very important for health. You want to make sure you're clean. Now, unfortunately, these soldiers, they're probably not getting a shower every day, or even a bath every day. Usually these guys, they're getting bathed maybe about once, maybe twice or so a week, and that's going to be in some sort of local watering hole, water source, that I have down there near the camp. And unfortunately, even though you are bathing in that could be a source of disease in and of itself. A lot of unsavory things inside that watering source down there. Maybe there's some parasites in there you probably don't want. Parasites, that could cause malaria. That's a disease these soldiers are going to be suffering from. So even though I can do things to prevent you from getting sick, sometimes it's not going to work, unfortunately.
can understand that.
So, yeah, but I am going to try and make sure you bathe, and the soap you're going to have to use, well, it would work. It is lye-based soap, so it would work to keep yourself clean, but it possibly would burn a little bit. And then afterwards, of course, you're going to retire back to your common tent. And when you take a look inside there, you're going to see there's a bunch of straw, a bunch of mud sitting inside that tent. That can be a source of disease as well. Something very common these soldiers would experience is something called scabies. That is a small parasitic infection that causes mild bouts of itching. Mild bouts to severe bouts of itching. And it was actually called something in the time period. It was called the itch. It was very, very uncomfortable. So a preventative I have for the itch is in the form of this salve that I have right here. Probably doesn't look like much, and it doesn't smell that great either. It's actually two things that, is kind of unsavory to our standards today. This is actually a little bit of pig fat, lard. Think if you fry bacon in a pan, you leave that grease in there. Yes, it's a little bit of that stuff, and it is also a little bit of this material I have inside this jar. This is called sulfur. And sulfur is very corrosive stuff. It can kill off all of those scabies, or some of them anyway. And it's also possibly going to burn your skin a little bit, quite like that lye soap. But one way or the other, I can prevent you from getting scabies, or I can go ahead and kill those scabies off. Because what this salve is going to do is, the lard that's in here, the pig fat, is going to actually soothe that itch. It's going to make your skin feel nice and good, which can be beneficial. And the sulfur is going to kill off any of those scabies that are there, or any of the ones that are on the surface of the skin. But just like pulling out those teeth, it worked, but it probably hurt. It probably didn't feel all that great. That's what these soldiers are dealing with.
So it looks like we always have to be on the lookout for side effects, but
oh yeah, side effects. And
side
really
effects
with
are
illness,
less.
That's what I'm looking for, usually, is side effects, symptoms of an illness, rather. I'm going according to what I can see and what you can feel. So if I give you a certain treatment here and you say, I feel better, well, okay. As far as I'm concerned, you are better. Doesn't necessarily mean you are, but we'll see about that in a couple days.
Well, thank you very much.